Hello, everyone. Welcome back to the Rise to Your Peak podcast. I am here today with my guest, Dr. Ashley Dwyer, who I'm very excited to chat with today. Ashley, how are you doing so far?
Doing well. Glad happy to be here. Thank you for
Yeah,
having me.
I'm so excited to have you here. Thank you for dedicating this time to be on the episode today. For our viewers, Dr. Ashley Dwyer is a pharmacist, a former NPC competitor, and she also owns her own coaching team, Team BDN Coaching. Is that correct?
You got it. Yes.
Yeah. They specialize in, nutrition, macro coaching, hormone optimization, functional healing. And I believe, doctor, you've also tend to lean into a specialty around prenatal care and pregnant women and keeping them healthy and optimized.
Yeah, I mean, it's so funny. We have like our age groups that we work with, right? And then it just kind of morphs into hormone optimization. So we do have menopause and perimenopause clients, but when we first kind of started, it was the 25 to 45-year olds kind of age
Yeah,
group. And so of course, that's when women are getting pregnant and having babies. So prenatal, postpartum, it just kind of comes with the territory.
it all comes. Yeah, totally. Well, I'm really happy to have you here today. I think our viewers are going to really enjoy this. A couple different topics from some different perspectives. We have a lot of female listeners, both in the fitness industry and just patients at the clinic. So I think this can be extremely helpful for them.
Amazing.
Um, so my first question is a bit more of a personal question for you. What specific issues, I feel like every single functional specialist, well, maybe not everyone, but majority of us have our own story of like what led us down this path, what led to us being so passionate in it and stuff. So if you wouldn't mind just humming a few lines about your own situation and what led to this functional journey for yourself.
Yeah, for sure. I mean, you nailed it spot on. Like we always have this thing that happens to us and then we dive deeper into different realms. We're like, I want to do that. I love this. Yeah.
Yeah.
So that's exactly where my passion came from. The Spark Note version is years of competing, under eating, overtraining, super stressful lifestyle, pharmacist, retail setting, completely burnt out my body around the age of like 27. So thyroid issues, registering as like perimenopause already at 27. Just everything was bottomed out. My fasting glucose was in like the 50s. I don't know how I was surviving. I was so tired all the time, even after a venti caffeine. Like it just wasn't great.
Wow.
So yeah, I look back at that lab work and I'm like, oh my God, how was I a human? So years of going through the Western medicine allopathic side of levothyroxine, Cytomel, Synthroid, trying all the different brands, trying to get regulated on medication, just kind of left me feeling the same, but maybe a little better because now I was on this medication. But, not to get into too much, but I didn't really have a thyroid issue at the time. I just had I was stressing my body out way too much, right? Like
Yeah.
secondary hypothyroidism.
Mm.
And that needed to be corrected. But instead, they slammed me on medication first, which wasn't the issue. So, of course, I felt terrible until I started getting into functional doctors and functional health coaches, started changing my lifestyle, doing more supplementation where I needed, not like the whole gamut of supplementation like some doctors do.
Right.
But it wasn't until I started eating more, training less, sleeping more, taking care of my gut health that I was like, oh, I actually feel better. And now I want to do this. Like instead of handing out pills behind a counter, I want to do this.
Yeah. I think that really shows the higher level of passion around improving other people's quality of life and improving other people's health. Because obviously, as a pharmacist, you're already very much ingrained in the healthcare system, but that doesn't always coincide with improving every person's, health and quality of life. So, and I always tell people, it's very easy to speak negatively about our healthcare system, but I always try to help people be cautious in terms of blaming the providers
Mhm.
because don't get me wrong, there's bad providers, there's bad everything, there's bad coaches, bad dentists, bad cops. Um, but it's the system. The system is set up in so many different ways to manage symptoms and not treat the root cause of the problem. And providers are very much handcuffed by insurance companies and big pharma of what they can and cannot do, or even what their first intervention might be. It's not the best for the person. It's what insurance considers the cheapest action to be. You know what I mean?
I'm having PTSD from prior authorizations. We can't talk about it.
Yeah, exactly. So you know exactly what I'm saying, which leads me to my next question for you. As a pharmacist, in the Western medicine trenches, so to speak, what practices did you notice when you were working in that scenario that kind of gave you the inspiration outside of your own personal experience? What gave you that inspiration to dive deeper into the functional medicine side?
I mean, so there's different areas of pharmacy, right? And I chose the one that's stereotypically the worst because I like people. That's what I like told myself. I'm outgoing. I like to talk to people. So retail pharmacy, especially working in like a Walgreens, CVS, drugstore type of situation is really difficult. Anything working with the general public is really difficult,
Yeah.
right? And the way that they put the metrics on the pharmacist, it's just there is no time to actually create change and to help. You're literally doing most of it by yourself. You're understaffed. Like, I'm going to say this and try not to diminish my whole profession, but like, it is not set up for safety. And as someone who needs to have their brain on and being focused and paying attention so that you don't die if I miss a drug interaction, it's not safe. It's not great. So it's just 12 hours stuck in a box with no breaks. I think now they've instituted like 30-minute breaks in the middle of the day for pharmacists, but you're
For
still
real.
working a 12-hour shift. Yeah. And you're understaffed. So you're doing a lot. Like a lot of people think it's just putting pills in a bottle. I wish, I went to school for four years to just put pills in a bottle and learn to count. So it's I can't tell you how many times I've gotten told that. Um, it's just moral burnout because you're really there to like help people and inflict change and you're getting all these corporate metrics and everything's about the money and you're like this is not why I came to do this and then people are like accusing you of making money off the drugs and you're like again I wish where's my check.
Right. Right.
So when you realize like no there's more to healthcare than this and I don't even get a chance to actually counsel patients because either they don't want to hear it while they're shopping they're in a hurry treating the drugstore like McDonald's or I don't have time to actually be able
Right.
to talk to you.
There's a line out the door. Yeah.
You're kind of just set up for failure every day. You're always behind and that like really wears on a person.
Yeah. I mean, we were just kind of speaking of this. Like,
Yeah.
I feel that this year already, I could only imagine that being every day of your profession and that moral feeling of, am I failing everyone who came in the door today? Because I may have missed something. I would have anxiety, you know?
Yeah, there weren't many nights when I would like go to bed worried that I messed up or missed something, but
Yeah.
it's a lot to ask of an individual and kind of like a thankless profession, and you're not
Yeah.
really seeing the rewards of what you're doing. So,
Sure. Yeah.
mhm.
So when you first got intrigued by the concepts of alternative medicine and functional medicine, did you have any apprehension from your current status quo to lean into that, or were you just fully excited to gain more?
Oh my gosh, when I first started my company, it actually started as something completely different than functional health. I just knew I wanted to get out of the pharmacy and I was like the fitness friend who helped everyone get in shape for things. And
Yeah.
so I was like 27, 28, and all my girlfriends were getting married. Like literally, I think I had 8 weddings in 1 year. 1 year. It was crazy. You go into debt in your 20s for your friends getting married. And so I was helping them lose weight for their weddings. And they're like, you should do this like as a side hustle. And I was like, I don't have time. What do you mean? And so the original form of my company started with helping brides like get in shape because instead of crash dieting, I would show them like the real way to lose weight. So they didn't do to themselves what I did to myself through my
That's
show.
yeah.
So it still kind of morphed on my passion and like, don't do what I did.
Yeah.
And then of course, like my real alternative medicine passion took over and the
Sure.
hormone health. And so it's morphed over the last 6 years. But There was definitely pushback when I left pharmacy. Everyone was like, "What about all that school?" I'm like, "What about it? Like, I'll be paying loans till whatever, but
Yeah,
better now."
totally. Yeah. No, that makes total sense. And it's interesting how you kind of just moved into that without even knowing you were going to move into that. It was just the path that life brought you based on the demands of the people you encountered.
Oh, 100%. I say this, one of my boyfriends I dated in my early 20s, who was a little older, was an entrepreneur. And I was like, there's no way I could ever run my own company. I'm risk adverse. Like, I want
Yeah,
the school and the paycheck. And like, we dated during pharmacy school. And now he laughs at me because I'm like, just kidding.
that is so
I
funny.
never saw this as my future, but I'm so happy it is.
That's so funny, and that's awesome that you were able to make such a drastic change, but kind of like never look back and dive in face first and be so successful.
Well, thank you. I mean, I did do both for 2 years. So there is that growing period of like getting
Yeah,
to a coasting spot, right?
sure.
But yeah, no, I think when you're really passionate about something, you just kind of you got to lean into it. It takes over.
Agreed. Absolutely. Now, so since then, since you've been working with, your coaching team and your clients, in your opinion, this is something I like to ask a lot of my guests. It's a common conversation. Um, what would you say one of the biggest issues holding women back from reaching their physique and health goals?
Yeah, there's probably a couple.
Oh yeah, it's a
Um,
loaded question.
It is. And I'm like, ooh, what is the first thing that pops into my mind? I mean, the general umbrella, I think, is going to be mindset and like their beliefs. So it's not even not knowing what to do. That's a big thing, right? It's not even, I mean, self-sabotage falls into mindset, but it's really like an all or nothing thinking when it comes to their health and fitness. Like as women, especially if you're in your 30s, maybe even late 20s, like you grew up with fad diets and restricting and, being shamed for food and a poor relationship with food, that this is what you believe. Like we've grown up through the times of like eggs are bad, butter's bad, this is bad, like everything's bad, meat's bad. Now veggies are bad, apparently. Like there's so much, right? So it's kind of more along the lines of like, you don't need to be so extreme. There is a balance. You don't need to cut out everything you love. Again, balance. You don't need to go 75 hard. We need like 75, like 365 moderate, right? Is that what it is?
Yeah,
Like just getting them out of that, like, I'm gonna do like all the extremes versus no, that's not what we really need to do to see change. And the
totally.
the stuff that's boring and what you really need to do is not sexy, so it doesn't sell. So
That you're nailed it, 100% right. And obviously, society plays into this by giving us this constant thinking of quick fixes and pill solutions or even diet solutions. And I feel like it may be human nature, it may just be American nature, but I think most people are attracted to the idea of something intense for short term versus something for the rest of their lives. And so the idea of I can lock in for 75 days, versus I can lock in for the rest of my life. There's that difference there. And I think that's why so many people lean into like New Year's resolutions or getting ready for summer or a wedding date. It's like I can do a short window. They can't fathom like their entire life being that. But like you said, if you don't go so extreme, it's much easier to make that your entire life. And if you
yep.
just made it a consistent, you wouldn't have to say, okay, 30 days, it would just be consistent.
Yeah, I look at someone just posted something recently about some 21-day detox, and I just like shook my head and I was like, that's why, like, you can lock in for 3 weeks and do this no sugar, no coffee, no whatever for 3 weeks. And you can't imagine doing it for longer because you're not supposed to. Like, nobody's telling you to live like that.
Right.
That is insane. And you're going to lose the results once you go back to your normal lifestyle. So, again, like, how do we get people off of this roller coaster or merry-go-round, whatever object you want to use of
Yeah.
hell?
No, yeah, I mean, I think that's 100% nailed it.
Yeah.
With specifically the prenatal and postpartum women that you work with, what are some specific strategies you use to both optimize the fertility aspect, but also the health throughout the pregnancy? Because I don't think both of those topics are talked about nearly enough.
Yeah.
How women can kind of like prime their bodies ahead of time. And now we see so much in terms of like, kids being born with all these autoimmune issues, toxicity issues, Lyme disease, stealth infections that could have possibly came from the mother in the womb. And so they're born with these issues now. And obviously, there's not a lot of education around that, so women wouldn't know better. So, how do we better help women prepare for a healthy pregnancy and providing for that child throughout that pregnancy?
Yeah, I know we're talking about women specifically, but I think there's data that also just came out that a lot of what happens for children also comes from the sperm and the male health as well. So we're going to
Yeah,
need to get men in our program too for fertility. But for women, and especially, it might look a little different for like a normal, a quote unquote normal woman versus a woman with PCOS. And we help a lot of women with PCOS get pregnant because they're usually infertile and have irregular periods. So this advice might be skewed a little bit, but in the general sense of the term, like preparing at least a year and a half to get your health on track before I mean, the longer the better, right? The same with menopause. Like the more you're working out and already active and putting on quality muscle mass before your pregnancy, you'll be better during and after. Like everyone wants to snap back after pregnancy, but A, that's not really a thing we should be striving for. But B, if you didn't have great habits before pregnancy, you're not going to have those snapback qualities after, right? And even if you did, it's not guaranteed because that's not something we should be rushing to do. But
sure.
we're working on more nutrients in the diet, eating as, not starving ourselves all the time, building muscle mass, getting the sleep in now, helping gut health and microbiome diversity, getting in like colorful plates. For women with PCOS, especially, depending on what type of PCOS they have, we're just trying to get normal periods back. We're working with their insulin resistance. Sometimes we do supplementation with these clients. Other times it's literally just calming down stress, removing some inflammatory triggers, and getting them to move more.
Yeah,
It's literally just like steps could be so beneficial for everybody.
sure.
So it's trying to get all of that back into a balance through lifestyle change. And then they start to get periods back. I've had a client or a couple of clients where we've had to get them off birth control in our program, which again, that is all a fun thing once you've been on it for years too. But if you want to get pregnant, you have to get off the birth control, right? And so we got to see what your hormones are doing. We got to see what's going on there. So setting them up the best possible way that way to get them pregnant and get them into healthy habits and behaviors during their pregnancy, especially for my PCOS ladies, we are trying to avoid gestational diabetes. So we are trying to, again, be very nutrient dense with foods, lots of fiber, protein, walking, like a lot of people don't associate a deficit with pregnancy, but you can get away with slight deficits in the first trimester. So we still will have that happen. I mean, think about the women who get absolutely sick and can't eat anything in the first trimester.
Sure.
They're definitely in a deficit.
Sure.
So
Yeah.
we can still kind of work on some of those goals in the first trimester, and then second and third becomes way more important for eating enough, eating
Feeding.
quality. Mhm.
Yeah. Fuel.
Yep, exactly.
That makes total sense.
Hmm.
Now, to touch on something you mentioned, going back to the male equation in sperm. Hum a few lines on that and what you've seen there.
I was gonna say I'm not really versed in it too much. It's like new stuff that I just passed through and kind of heard. So it's
Yeah,
on my like docket to look into. So I don't know how much I can speak to it. But
sure.
obviously, yes, the woman is growing the baby, but it's still 50% DNA from the father. So if the father has bad microbiome, gut diversity, has issues with health, inflammation, sorry, I don't know what's going on with my voice. These Texas allergy things here.
Oh
Okay.
yeah, yeah, it's a rough time.
So 50% of that's coming from the father. So the father's health is just as much responsible for the allergies of the baby, the inflammation, everything. And nobody really assumes that because the mom is growing it. But
Yeah.
Hmm.
So I'm very interested in this, and I would love for you to share whatever you find, and we can
Yeah.
maybe chat about it more at a different time. From what you did see, did it seem like pathogens could be passed from the man as well?
Pathogens, so like infections or things like that.
Infections, yeah,
I did
or
not
like Lyme disease.
know. I didn't look into things like that. But aren't most cases of Lyme from like tick-borne illness and things like that?
Well, to a degree, yes. But what we're seeing now is if a woman has Lyme disease during pregnancy, that can actually be passed to the child. So the
Sick.
child's then born with Lyme. So that's kind of what I'm referencing is making sure the woman has the knowledge of her overall health in
Yeah.
place and knowing what could potentially transpire to the child down the road.
Yeah, that's terrifying. I don't know
That
that.
actually happened to my nephew. He's on the spectrum of autism. My sister unknowingly had Lyme disease. I think she actually contracted it while pregnant. She lives up in Washington, D.C.
Hmm.
He also ended up with the MTHFR gene mutation,
Okay.
then got loaded with vaccines. He was a 2020 COVID baby. That was a shitstorm, put him on the spectrum of autism. I was kind of the first person to bring up GI testing and getting from a functional scope. And now they're working with a functional pediatrician in Florida, and he's been treated for Lyme, MTHFR, gut dysbiosis, very intensive things for only a 3 year old, but significant changes in his cognitive performance, speech, socializing. So pretty cool stuff. But personal experience has kind of led me to be more intrigued about those topics.
Yeah, 100%. I was like, I feel like that is, I always say there's like tiers to health and wellness, right? Like the first tier is just literally the basics, like, eating more, eating less, depending on what your goal is, working out, walking. And then like second tier is like macros and certain more nuanced things. And then the higher tier is like this kind of stuff, like the really interesting gut health diversity, the ingredients, certain ingredients, things like that. Like so many people are worried about the top tier and they haven't even mastered the
Yeah,
bottom tier yet. And like
totally. The
we'll
foundation.
we'll get you there. Yeah, yeah, yeah. Exactly. The foundation. But I'm super interested in that stuff too, because then you'll read data about how babies will have different immune systems and
Yeah,
flora based on
yeah.
C-sections and natural births. And it's really fascinating.
It's very fascinating. And it seems very new topic
Yes.
still, new
Yes. Yes. Yes.
discussions. Even I mean, gut health is still kind of a newer discussion, but it's at least been around for close to 10 years from a functional perspective. But I think we're just continuing to learn more and more, and that's a new topic that I haven't seen a ton of discussion around that I'm just very interested in. And so yeah, definitely keep me posted and
Yeah.
I'll share anything I find with you too, and we can maybe do some deep dives in the future regarding that topic specifically.
Perfect.
What strategies do you tend to use or lean on to when it comes to women and the connection between, like hormones and metabolic function, weight loss resistance? What are some discussions you have with women and some strategies do you use?
Yeah, I love this question. A note before like I dive in. There's definitely a difference in coaching approaches online, right? And you have the people who are functional coaches or integrative coaches sometimes, or you know, we do lifestyle changes first. There are a lot of people who will look at lab work and who will assess problems and immediately start a client on like 8 new supplements. That's not going to be the way we do things. So we're doing an entire like intake of their diet history. We're having them do logs before they even start working with us so we know what they're eating and what type of food choices they're making. Hopefully they're not lying. We tell them not to. Um, But we are doing an entire lifestyle overhaul for the same reasons that we said, like, we need it to stick forever. The way you get the results is the way you keep the results. And we want you to be like the 2.0 version of you when you leave, which means we got to shift a lot of things to
Yeah.
work with your diagnosis, get your diagnosis in remission, or just get you the results that you want. Because what you're doing is clearly not working.
Yeah.
We need to fix it. So our interventions are going to be purely right out the gate, lifestyle changes and interactions in that way. If they do come in and obviously, we need some supplementation. I will say every client always needs vitamin D. Like it's just a thing. Vitamin D and magnesium could probably benefit everybody. I don't feel bad
Agreed.
saying like you
Yeah.
can use this.
Yeah.
Um, but maybe we have some like low stomach acid with our hypothyroid patients, or we have like, myoinositol and berberine and things like that for our PCOS clients. Like everyone's going to need something different. I don't have a blanket approach for everyone,
Yeah.
but it's mostly lifestyle changes.
So
100%.
low-hanging fruit items first,
Sure.
sleep, nutrition, life, day-to-day actions and choices. What people don't understand
Foundation.
is those are tend to be the cheapest and or free suggestions that we make, you know? So if we can get free results, let's go ahead and, stay in that bubble as long as we can before we, start adding things to the equation. Um, with regards to, supplements and nutraceuticals, is that where you guys basically hang tight, or do you lean into peptide therapy, hormone therapy, anything from I guess you could still call it pharmaceutical intervention?
We are not partnered, and this is almost by choice. Like I haven't looked into it. I haven't wanted to. We aren't partnered with anyone where we can get HRT or peptides or anything like that. If a client does want HRT or they do need HRT, we have them talk to their doctor. We can run blood work and we do interpret blood work, but I'm not prescribing or diagnosing anything for a client. I do send them off to someone else if they want it. I'm not against peptides and I'm not against HRT. It's just not something that I've wanted to, like, we are lifestyle coaching.
Yeah,
So that is kind of what I want people to fix first. And then if I do have the connections where I feel like something would be beneficial for them, we'll reach out and get that for them. But it's not a
absolutely.
standard. Mhm.
No, I love that. From kind of we have the same point of view from very different lenses, you know.
Yeah.
Owning an HRT clinic,
Yeah.
one of the biggest things that I made sure our entire practice does is not just give them a laundry list of options.
Mhm.
Our very first discussion is tell us about your sleep, tell us about your lifestyle, tell us about your nutrition. We're actually turning people down for HRT oftentimes and saying your cortisol's through the roof. There's all these different things we can see. You're not detoxing estrogen properly. That progesterone is converting to cortisol. So
Mhm.
HRT isn't even going to help you right
Right.
now until we set that foundation and then come back around and see maybe you're a candidate for HRT. But that it's the same approach because we've seen it time and time again. If the foundation isn't laid, are you really going to benefit from those peptides or HRT or anything? Or is it merely band-aiding some of your symptoms? It's not even fixing all the symptoms, you know?
I love that. And that was what the thyroid medicine for me was potentially doing, was band-aiding the situation. And I had no foundations. I
Yeah.
had the opposite foundations that I should have had.
Well, and we obviously, because of my history, we have a lot of competitors and
Yeah.
fitness enthusiasts come to our clinic. And, if their gut and liver are super dysregulated, that testosterone could heavily convert to DHT, causing
Yeah.
that woman a lot of negative symptoms.
Hair loss.
And it's not necessarily the testosterone's fault. It's the body is just not utilizing it, metabolizing it properly. Same thing with progesterone. If that progesterone is converting all to cortisol, more anxiety, weight gain, inflammation, trouble sleeping, all their issues got worse instead of better.
See, I love that you said that. And I really do love your approach because I see it in men too. Like I don't treat men, but the TRT epidemic with men of like wanting it just to be jacked or feel better, but they don't, and they wonder why, like foundations, right? But
Totally.
with progesterone in women, so many women are low progesterone because we're just high cortisol all the time now. We're not processing correctly. I'm low progesterone. I know this, but my stress is terrible. We're not talking about me. Entrepreneurship might be more stressful than pharmacy. I'm not sure, but
Yeah, yeah, it's a tough call.
there are no days off here. But if I just took sublingual or just took any type of progesterone, that's not guaranteed to help me feel better because I haven't mastered the stress response yet. And
Right.
I know that it's a band-aid, right? So
Totally.
yeah, yeah. And I think what you're probably feeling a lot of too, or what you get a lot of too, is people come in just wanting the band-aids or the easy fix or something like that to help them in the moment, but not realizing like you're gonna have to stay. That's like the Ozempic thing right now. Like you're gonna have to stay on it
Yeah.
for, or fix your stuff,
Yeah.
fix your
Well,
shit. I don't
because they do their own research and they're checking a lot of boxes for low T or hypothyroidism, but it's a lot of it's coming from the adrenals. And
know.
what they don't recognize is stress responses and the body's adaptations to stress and your anxiety, your sleep issues, your autoimmune, your hypothyroidism. It's all related to stress. It's not related to a lack of production of certain hormones, if you will. And like you said, we run into so much with men. A lot of our focus today has been around women and women's HRT, but men is the same equation. If they're not detoxing estrogen, now we have emotional issues. Now we have gynecomastia. Now we have acne. We have all these other issues, and it doesn't mean they should be taking an estrogen blocker used for cancer patients. It means that they need to metabolize estrogen better or reduce their testosterone dosage, because that's another issue is they're taking way too much.
Yep.
Um, so I mean, yeah, we run into these issues all the time. We've had guys on TRT for 5 years and their levels still suck. And as soon as we approach the GI and metabolization of hormones, they're going from 600 nanograms to 1100 nanograms. No difference in dosage. It's just we fixed the metabolization issue.
I love
So
that.
I feel like there's always a stigma around HRT clinics. The 99.9% of HRT clinics is a prioritization of profits. And it's like, Ashley, let's see how many things we can sell you. You know, that's the business model. But we're taking a very functional medicine approach here. Our goal is not profits. I actually left two clinics before opening my own because that I wanted my focus to be health optimization and helping as many coaches in the community find that place of trust where we bridge the gap with Western medicine and functional medicine and not have these concerns or distrust.
No, I love it. I think it all should be collaborative, and one day, hopefully, we'll all be way more collaborative with doctors' offices. And,
It's a work in progress.
it's funny. One day on the internet, I will be like, you're just a doctor who's paid out by big pharma. You know nothing, stay in your lane. And then another day, I will be, you're a coach. What do you know about like medicine or drugs? And I'm like, do you not see my handle? But it's funny because I think the DR is losing me credibility online after COVID. It's so funny. But yeah, yeah, eventually we'll gain the trust of everybody and everybody will be working together.
Yeah. Yeah. Well, and I think the real change comes from practitioners like yourself who did dedicate the time to that Western medicine knowledge, but also recognized the void,
Oh,
continued their education. I don't think people appreciate that enough of like you've spent six figures on education, all your time and energy. Now you can finally recoup that, but instead you're choosing more education and more skills to help people. The ultimate sacrifice, in my opinion.
yeah. Yeah. And I mean, I can't, no regrets. I don't know.
Yeah,
It
I
was
love it.
totally the move to make. I mean, even opening up your own clinic is no small feat or
No,
cheap task. So
no, but we're here because we're passionate.
Yeah, exactly. Now we just need people to lean into this side instead
That's
of
it.
the shiny object syndrome.
That's
Mhm.
that's it. That's a good one.
Yep.
All right, last question for you. I know we're both busy today. And this one should be a good one. What has been one of your favorite client cases that you've worked with so far in your holistic coaching? Success story.
Oh my gosh. Okay. One of my favorites, she's been with me for a while, so I do want anyone listening to like understand that this is not quick fix material, right? Like this is a whole lifestyle shift. She came to me in 2020, I believe, 2021, one of those years. It's like all a blur in the pandemic.
Totally.
2020, because I was still a pharmacist. And she had just been hospitalized for acute pancreatitis and like high triglycerides and was looking for just like a dietitian or a health coach. And, we're not dietitians, or I have one on my team, but I'm not. And at the time, I was only like a single solopreneur. I was just doing this myself. So someone who worked with me at my pharmacy was friends with her on Instagram, saw her, referred her to me. We got her in just for simple like weight loss and cleaning up her lifestyle and fixing her cholesterol issues because triglycerides were through the roof. And at the time, she was dating her boyfriend, and she has been with me throughout the trajectory of our time together. She has been with me through her dating, her engagement, her marriage. Like I went to her wedding, her now pregnancy, and she's pregnant now with a healthy baby boy. And it's a success story because she had very irregular cycles. Even on birth control, it was not working. And her gynecologist told her, you will never have normal cycles off of birth control. You cannot get off of birth control. And I think now, before she got pregnant, we were like 2.5 years off of birth control with normal cycles. So we got her to regular fertility, got her through weight loss. Everything is within like a normal range on our lab markers, not even normal, optimal. I don't like normal ranges,
Right.
optimal. And now she was able to get pregnant basically like the first or second try and
Amazing.
yeah, have a successful pregnancy. We have her glucose test coming up in a couple of weeks. So I'm like, okay, we gotta, she was inflammatory PCOS, not insulin resistant, but still had a little raised markers. So I am like, we're working through that. But that is one of my favorite, is just being able to like get her off of all these unnecessary meds, shift her
Yeah.
lifestyle, and be able for her to like expand her family.
Yeah.
It's awesome.
That is awesome. I mean, that is truly a amazing success story, and I'm sure she's going to be forever grateful for you. So that's awesome.
I love it. It's not really even a joke. There is some science to it, I think, but my company has only produced baby boys.
Oh, wow. That's very interesting.
Yeah, and I looked it up because I was like, there has to be something with the type of women that we help and the amount of androgens that are already kind of circling in their system from PCOS and then having boys. I haven't had a girl yet.
Wow.
Super interesting.
Let's lean into that research too.
Yeah.
Let's take a note of a couple of things we need to dig into. That's extremely interesting.
Yeah. I even like had to go back and be like, okay, let me see how many healthy pregnancies we've had on our team, and they're all boys.
Wow. That is so interesting. That's very cool.
Hmm.
So to any of the viewers, if you're very adamant about a boy, you know where to go for your
PCOS.
assistance.
That's so bad, but
That's so funny though.
I
That's
know, I
crazy.
don't know. Obviously, like there is, I don't know how much data is into it, but it's just like a fun causation, correlation, or
Yeah.
correlation. Yeah,
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 for sure.
yeah,
Well, Dr. Dwyer, I appreciate this conversation so much. I'm actually excited for us to chat about a couple other topics on the side now. This episode opened up a few more uh, situations for us in the future to chat. So I'm very excited about that. I'm sure the viewers are going to love this episode. If they do want to connect with you, follow you, learn more about your services, tell us where we can reach you in terms of social media, email, websites, the works.
yeah. The best place to reach me is Instagram at dr.dwyer. So at Dr. Dwyer. Send me a message in my DMs. I'm usually always the one in there responding. I'm very responsive, so I'm very much in Instagram. You can find me there. Website would be teambdncoaching.com. And then email you can find there. It's like too long and it's going to confuse people with my former company name. But you could just message me on Instagram. We'll give you emails, all of that.
Awesome. Okay, guys. Well, definitely follow Dr. Ashley Dwyer. She's extremely educational and very helpful to our community. Um, Thank you again, Dr. Dwyer. I hope you have a great day, and let's touch base soon about some of these other exciting topics.
Yes, of course. Have a good one. Thank you.
Thank you. Bye bye.